I have known Joel since about 2017 when we did the social medicine class together. That was in Gulu. And that class was mainly educating healthcare professional students about social advocacy and social medicine and how social, political, and economic determinants of health come into play in the health of our population.
Welcome back once again. I'm here with two visitors here who are going to introduce themselves first, then we continue on with our program. So you can take.
Thank you very much. My name is MIREMBE Joel. I'm a medical doctor, a fellow of physiology here at College of Health Science at Makerere University. I'm an alumni of Mbarara University of Science and Technology, MBSHB. Currently a fellow of physiology at the Department of Physiology, Makerere University. I am a teacher, I'm a leader, I'm an advocate for health equity and the welfare of health workers. In particular, I want to advance principles, values of universal health coverage and One Health. So I am here to interest myself in leadership of the Uganda Medical Association. But before that, I am currently a volunteer tutor here at Makerere University, undergraduate students biomedical sciences. I'm also tutoring at King Caesar University, still biomedical sciences. I am a founding member, and in fact, a co-founder with the Ita Medical Services. We trade as Ita Life, and what we do, we want to revolutionize medical access to doctors, access to doctor-led medical services in our country and in the entire Africa. So what we do, we have mobile doctors that out of just a phone call, whether you're at home, whether you are at your workplace, whether you are in a school, you just give us a call and we send a doctor to review from wherever you are, makes an assessment, takes off samples, and the drugs and treatment can be also administered via our nurses. We are doing mobile antenatal care services. We are doing elective surgeries via our facility around Kavuli. So we are trying to innovate, create, and do things in a different way, but keeping the values, the principles of medicine intact.
Welcome everyone. We have a visitor for you today. She introduce herself more to us and tell us what she has for us today. You're very welcome.
Thank you. My name was Provia. I'm a graduate nurse from Makerere University and an MPH scholar at University of Manchester, and currently coordinate the operations of the clinical trials unit at the Infectious Diseases Institute. I have known Joel since about 2017 when we did the social medicine class together. That was in Gulu. And that class was mainly educating healthcare professional students about social advocacy and social medicine and how social, political, and economic determinants of health come into play in the health of our population. And then in the course of 2017, we organized together a global health focus course that was aiming at teaching health professional students in the different universities in Uganda in global health in the local context, looking at different social, economic, and political determinants of health. And as you may all aware, you've witnessed the works of Joel Mirembe. He was the initiator of the FUMI and was actually the inaugural president of FUMI. And we saw his advocacy forefront and how he advocated for interns, medical interns' welfare and also increments in their salary. Unfortunately, I didn't enjoy the fruits of his work, but subsequent years have enjoyed, and he has also been still at the forefront of supporting and mentoring and nurturing uh, leaders that have come to support the works of FOMI.
Since 2014, at least when I was in my upper years of medical school, I have been a strong committed, consistent, credible, compassionate advocate of welfare for doctors, welfare for all health workers in this country. I will tell you that in 2016, I was president of medical students, and we mobilized along with the interns then when issues like not paying medical interns were being suggested by the ministry. We moved radio to radio, we moved office to office, we engaged government, and those were rescinded, they were taken away. Of course, it even included court. So I have been around as at different levels of leadership, medical students leadership, leadership in UMA, advocacy. I have been a part of policies being drafted like the 2017 internship policy, which has been put in the limbo up to now. And some people think it started this year. No, it has been around and we have been part of the process. We have been part of the process of advocating for doctors. And like as a chairperson for the central branch, I will give an example. We came when the branch is not doing anything almost. Our predecessors, I tell you that we didn't even get literally like handover files or anything. But we have over time made efforts on zero resources. We chose to mobilize resources and we have done a lot of activities in terms of building a brand of the Uganda Medical Association, the brand of the Ugandan doctor. How? We have engaged the community through 4 medical camps. And in those medical camps, at least 80 to 90 doctors have come to the community, offered free medical care services, and this has built a relationship between us and the doctors. Of course, you realize in December last year, we got unfortunate happenings, which really probably almost created a boundary between us and the public, then government of several government officials. But you know, I have been there to make sure that this is corrected. And we are here to come and take charge of the leadership such that we can do things the right way, based on professionalism, on principles, on values. Yeah, that's why I have been telling my friends, the voters, that I come with a people-centered approach. The people are the doctors, the people are the clients that we serve. We want to build the Uganda Medical Association as an organization. We are 50 years plus old. Why is it that we don't have a home? You know, doctors are noble. Doctors are honorable citizens in the community. But how can our headquarters be a small thing like this? Why don't we have a house which can even provide some specialized services to the community? So we are going to embark on building a robust, strong, organized, credible secretariat. We are going to embark on a key process of finding job opportunities for doctors, especially young doctors, even if it means to find these opportunities abroad in other African countries which have gaps and are willing to take in our people. We shall engage those governments, we shall engage their mother associations such that we have these opportunities secured. We are going to make sure we engage government to recruit doctors up to Health Center 3. We have made efforts and finally government gazetted doctor spaces at Health Center 3 level, increase the spaces at Health Center 4. Now, we want doctors in those positions. We want to engage the private sector in particular. We are going to organize symposium and invite these employers in the private sector. We want them to pay our doctors well. We want them to create incentives that motivate our doctors to pay well. But paying doctors in some funny way is not acceptable. We want to engage all stakeholders, and we have what we call the Uganda Medical Society, such that we can get legal mandate over training, such that we can regulate actually UMA, like Pharmaceutical Society of Uganda does this. they regulate how many medical students get into school.
Uh, Joel Membe, from what I've described and so many other aspects you may have interacted with him, it really shows someone who is a visionary leader, someone who is committed, someone who commits to the vision, someone who drives things with passion. I know Joel is very passionate about the medical profession, and I know if you vote him for UMA president, I know UMA will not be the same again. What is your slogan?
The UMA want. The UMA want.
Yeah. So Joel will.
UMA want.
Yeah. Joel will give you the UMA you want.
Thank you so much, Joan. That was quite a good description of Mr. Joel.
Yeah.
We look forward to his good work, and we hope the rest of you people who are listening to, who have listened to what she has said, you will really give him the votes.
The other thing, we are going to encourage group practice. Doctors should be able to get in groups of 5, 10. They open up medical facilities because they have the expertise. As they be working in other facilities, they should be able to open up their own facilities, grow them, and then they should be able to leave the other jobs for non-investors. Those ones who have any investment, whatever, we want to put them in groups and they invest across the country in villages and towns. We are going to operationalize our branches as UMA. And one of the things we have in place is that these branches, the reason why they are not operating because we don't have enough money. So we want to open up a branch office, and that office is not just a secretary. It is a clinic where 1, 2 doctors can come and work, where some nurses can work, generate some revenue to sustain the branch activities, such that the officers of the association there can go and reach out to all the doctors in that region, recruit them into Uganda Medical Association, bring them to the SACCO, which is the financial arm of the Uganda Medical Association, because it is in the SACCO where we are training people, giving people financial literacy. It is in the SACCO where there is access to cheap credit. You get? It's the SACCO where we are training people to become socio-economically secure, socio-economic security. We want doctors not to be survivors. We want doctors who are secure economically, socially. We want to bring back the prestige, the pride, the credibility that came when we were joining medical school to the profession and also the society.
Thank you so much, Dr. Joe. Those were very, very, very good words from you. And I myself, if I was among the viewers out there, I would really vote in for you. So, Dr. Joe, why do you think you're the best candidate for this?
I first of all appreciate all other colleagues who have expressed interest to compete with me. That's good. It shows that our organization is growing now that leaders are picking interest in making a change. But what makes me the right man for the right job?
Yes.
We have packaged our message in a consultative mode, and we are saying we want to build, design a sustainable UMA, and that's the UMA we want. And we stand for the Ugandan doctors. It's not standing for MIREMBE, it's standing for the Ugandan doctors, it's standing for the clients of the Ugandan doctor. So why? We have been here and we have gone through all the ranks of membership, of exposure. We know diplomacy, we know industrial action. We know the policies. We have been in these meetings of drafting them. So I am exposed, and I believe I bring on that experience. Currently, I have been the chairperson of the central branch of the Uganda Medical Association. Any honest person will tell you it has been the best performing branch since I took charge.
Yeah, that's so good.
We have done community outreaches. We have done health education for over 10 radio talk shows. We have lobbied and we have sent doctors there to educate the public. But also, when government threatened not to pay medical interns, because some selfish individuals had gone there and lied to the president and his team, as chairperson, Central Branch, and my team, we got our hands dirty to make sure that the interns, when their payment is reinstated, and they all get deployed. We did that over 3 months, and we succeeded at that. The Association for Medical Interns had been taken into political limbo. We have worked with the interns and restored the glory of that association, and now it is fully in the hands of the medical interns. The SHOs pay. We have been there to advocate for them, and we are doing all this on our own budget. We don't have any budget from either the National Executive Committee or anyone, but through lobbying from friends, we have the capacity to do lobbying. I'm telling people that we are going to build a Uganda Medical Association house, and we are going to do that through partnership, lobbying, and massive membership mobilization, in addition to the already existing resources at the Secretariat.
So, Dr. Joel, please, you can make your conclusion and ask those viewers out there to vote in for you. I think you've all heard his wonderful words and what he's willing to do for you. So let him conclude for us.
Thank you very much to you and the hosts and the viewers. I want to let the doctors outside there, one, sign up, subscribe, and pay membership dues such that you join the register. Okay. 2, vote for the UMA we want. I am very committed in terms of time, in terms of experience, competence to lead you. I want to be able to reorganize the Secretariat. I want to be able to make sure that the doctors are running to subscribe. We are not chasing after them because of the value addition in terms of what UMA adds to the Ugandan doctor, what UMA adds to the Ugandan society. We want to make sure we regulate our niche very well, because that is important to us, the workers, but it's also important to society, because the more we are regulated and organized, is the more we shall give quality service. Then the public will appreciate and pay us responsibly for the good service we are rendering to the community. Please vote Dr. Mirembe Joel for the best. Vote Dr. Mirembe Joel if you want a UMA that represents the real doctors. Go back to Gamba. That is never joining a medical school.
Have a good evening.
All right.